Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast.
Hello and welcome to Here's to Your Health podcast. I'm Brandi Ruskell, a marketing specialist at Crawford County Memorial Hospital. And on today's episode, we're talking with Dr. David Wright, one of our general surgeons at CCMH, about tonsillectomies and adenoidectomies. So Dr. Wright, thanks so much for joining us.
Oh, you're welcome. Thanks for having me.
Dr. Wright, for those who may not know, what exactly are the tonsils and adenoids and what role do they play in the body?
The tonsils and adenoids are part of our immune system, and they're in the throat. The tonsils are actually the first line of defense for bacteria, virus in our throat, and they're a part of our immune system and part of the lymphatic system that helps fight infection.
Many people may have heard of a tonsillectomy, but they might not know what an adenoidectomy is. Can you explain the difference between the two and when each might be appropriate?
Well, they're both pretty much the same procedure. Tonsillectomy is removing the tonsils, and an adenoidectomy is simply removing the adenoids. The adenoids sit, if you open your mouth, and it basically goes straight back from your nose. That's where your adenoids are. And so they're similar in tissue and a similar technique to remove the two.
Okay. And what are some of the most common signs or symptoms that someone might need surgery, especially children?
Well, usually what happens is if kids have chronic sore throats, frequent infections such as strep throat, that they would, benefit from a tonsillectomy. As well as some kids have such big tonsils they tend to snore. And the tonsils can even be so big that they almost block the airway and cause the snoring, and then subsequently the kids don't sleep well. And so we would recommend they get their tonsils out.
Okay. And parents are often nervous about surgery or whenever it's mentioned. How do you determine when surgery is the best option rather than just continuing to treat and monitor?
Well, usually, so if a child, there's kind of a rule that we use, or a general rule that we use as to when we start considering tonsillectomy and adenoidectomy. For example, it's the 7-5-3 rule. So if a child has had 7 infections within 1 year, or 5 infections within 2 years, or 3 infections within 3 years, that's what we would consider chronic tonsillitis, and we recommend they get their tonsils out. The surgery itself is, we do it in the operating room, of course under general anesthetic. It doesn't take that long to do it, and we have a nice machine that we use to remove the tonsils that decreases bleeding and pain. And so the procedure itself probably takes between 30 and 60 minutes for actually me to do the operation, and then the child probably another hour and a half or so to recover and wake up and get out of the hospital.
Okay.
Yeah.
So typical recovery, are there any things that parents or adults should be prepared for during the first week or two of surgery, or are there differences for adults and children?
Absolutely. Of course, the main thing is sore throat. Kids, adults are worse. Kids, they bounce back from tonsil surgery quicker, they recover better, but for some reason, adults are just, it's really tough on them. And I mean, you're talking of a good 2 weeks of pretty severe sore throat. And kids, it's a much shorter period of time. Usually what I do is I tell them you can expect a sore throat or a scratchy throat even up to 2 weeks, and then I see them back in the office. I tell them to kind of stay on a soft diet. Like when I grew up, we told them to ice cream and cold things and stuff like that, which we don't necessarily recommend a lot of dairy after surgery, but it's okay. They can, just get plenty of fluids, keep them hydrated, and they like cold things too, and ice packs to the throat and things like that. But yeah, kids bounce back pretty quick. They do pretty well, but everybody's different. But adults, it's pretty tough on them. that's why I kind of, adults it's a little bit more risky too, and that's why I kind of limit my tonsillectomy practice to kids and teenagers.
So if an adult had to have surgery, are we talking time away from work? Is it just, okay.
Absolutely, yeah. Time away from work, and everybody's different. But boy, I've seen people out 2 weeks.
Okay.
Yeah.
And what advantages do you think local families have by having you and Dr. Rick perform the surgeries here in Denison?
Well, I think the nice thing is that we're here. One of us is always here, and it's close to home, travel time, if they live in the area, they don't have to drive, the hour and a half to Omaha, let alone 2 hours to Des Moines, or even, those distances, we're right here. And then, heaven forbid, if there's a complication, which is rare, but it can happen, and bleeding is the thing we worry about as a complication, and we're right here to take care of it.
Mm-hmm. So if someone thinks that they or their child might benefit from surgery, what's the first step they should take?
Usually we'd have them see their primary care provider, and then, which they usually already are, and so they can then make the referral to us for consultation as to whether we think that tonsillectomy, adenoidectomy is going to benefit them. But usually by the time we see them as the surgeons, the decision is made. The family practitioner has decided that, they need their tonsils out, and then we get to see them.
Okay. So Dr. Wright, thank you again for taking the time to join us. I really appreciate it, and I think it's comforting knowing as a parent that this kind of surgery is available right here in Denison with people we know, people we trust. We can come and talk to you anytime, like you said. So for our listeners, if you or your child is experiencing frequent sore throats, loud snoring, trouble sleeping, I think Dr. Wright mentioned ongoing ear or sinus issues, talk with your primary care provider. If surgery is appropriate, they can refer you to our general surgery team to discuss options. To schedule an appointment with a CCMH provider, call the CCMH clinic at 712-265-2700, or you can visit us online at ccmhia.com. Thanks for listening.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.